The Sharp-C submission is priority contact, a significant contribution to healthcare workflow in 3 ways. The design was based on an understanding of clinical workflow and how to improve it with health IT. Simulations and expert assessment estimate that priority contact can reduce non-productive physician time by about 50%, and priority contact has been evaluated and revised based on usability testing. We have critical nationwide need to reduce the cost of healthcare. Providers are faced with increasing challenges to provide efficient, high-quality care to their patients. With modern care dependent on specialists, labs, and other patient services, providers often must rely on remote communication to discuss important medical information with patients. Providers find themselves relying on multiple modes of communication to connect with patients to develop effective treatment plans. Although there are several options for communication, many positive test results require an interactive conversation between doctor and patient in order to interpret the results, answer questions, and decide on a treatment plan that will be effective. But doctors currently spend hours of unproductive time just trying to speak directly with the patient. What if there was a way to leverage your EMR system to help you launch and manage communications with your patients and help you understand how to maximize your practice's communications processes? Priority Contact is a new web-based application to manage and maximize patient communication by leveraging the power of your EMR. Priority Contact manages contact with patients after they've left the clinic and new information relevant to their treatment plan has arrived, such as a positive test result. Priority Contact is driven by a contact plan to make reaching out to patients efficient, effective, and manageable. The provider selects one of 4 contact plan priorities: urgent, life-threatening communication, serious, life-changing communication, important treatment-altering communication, and communication about an existing treatment plan. In addition, patient information and preferences for communication modes are captured from the electronic record. Now let's see Priority Contact in action. Let's suppose the provider received test results for her patient, Amy Young. The provider interpreted the test results and made adjustments to Amy's care plan. She determined that she needs to contact Amy, and it's a routine follow-up that her practice conducts after every lab test. To set up a contact with her patient, the provider has only to select the patient record and then select the Priority Contact icon on the Smart App dashboard. When Priority Contact starts, it imports the data the contact plan needs from the patient EMR. The provider reviews the plan summary, checks to make sure the settings are correct, and sets Priority 3. From the Priority 3 control, there are 2 options: Launch Contact Plan or Call Now. Call Now initiates a live VoIP phone call to the patient's preferred phone number. This is simulated in this screencast. If the provider reaches the patient's voicemail, she can speak her own message or simply click Auto Call and have Priority Contact leave a pre-recorded message, providing the patient with a number to call at a designated time. The provider also has the option to edit the settings for the contact plan. These settings include the patient's preferred mode to be contacted, a personalized auto call message or the frequency of the auto call, and a personalized patient health record email message, which also allows the option of attaching a lab report. It's important that Priority Contact also provides the provider with a way to track and verify communication. This is done through the Active Contacts tab. When a contact plan has been launched, a record of the plan appears in the active queue, showing when each plan has been launched and for which patient. Let's assume that the provider has a Priority 3 contact plan for Amy. Then sometime later that day, Amy called the provider back, and Amy got the test results relayed to her. The provider is ready to resolve this contact plan, so she searches for Amy in the active queue and resolves it. If an active queue grows long, the provider can sort by priority level, patient last name, time and date, or by a text entry search. Priority Contact can have measurable benefit to eliminate substantial non-productive effort and time. It was designed to improve the efficiency of clinical care by understanding its workflow and how information technology could be integrated, so the two will work together as a matched pair of design solutions. Priority Contact is a product of a strategic partnership and collaboration between the University of Washington Department of Human-Centered Design and Engineering, General UI, Sharp-C, and the Veterans Health Administration.